Planned Parenthood clinics in Maine are getting ready to provide health care services they will not be paid for.
So just last week, an appeals court overturned a ruling by a lower court concerning Medicaid funding and organizations that provide abortion services. Rye Wooten explains what this will mean for clinics and patients receiving Maine care.
They're a vital resource for this community. Vital.
There's a Planned Parenthood office that sits right in the heart of Portland, across the street from Monument Square. They offer healthcare services like cancer screenings, birth control, STD and STI testing, as well as abortions. Oftentimes, many of the patients they serve have Maine care, which is the state's Medicaid.
In our 2024 fiscal year, 27% of the 7,100 patients who received care at the health centers here in Maine were on Medicaid.
Trump administration officials say they don't want federal money going to any organization that provides abortion care. The president's tax bill includes provisions to defund Planned Parenthood, starting with restricting access to Medicaid funding. Those provisions were temporarily blocked from taking effect after a judge approved a preliminary injunction in late July. Now, after an appeals court overturned the injunction last Thursday, Planned Parenthood clinics in Maine and nationwide won't be able to receive insurance payouts for any of the health care services they provide to patients who have Medicaid.
So, at Maine,
Lisa Margulies from Planned Parenthood Northern New England says their clinics are often the first and only providers their patients see in an entire year.
The truth is, if we fall out, cancers will go undetected, STIs will go untreated, patients won't get the birth control they need to plan their families and futures.
The change creates a $900,000 loss in funding for Planned Parenthood Northern New England and Maine. Jean Malloy says she and other Mainers fought for their rights, and this is a loss of more than just money.
Back in the late 60s and 70s, we fought for civil rights, human rights, women's rights, and now here we are doing it again in 2025. How is this possible in the United States of America?
In Portland, Rye Wooten, News Center, Maine.
Staff from Planned Parenthood New England say offices will continue to serve Medicaid patients. She says they'll be working now to raise more private funding.